will not be our talking point. Yes, today it's going to be all about LASHMA, Rural Health Scheme. Yes, the ways that the Lagos State Health Management Agency is making efforts to make inroads into the rural areas to bring the gospel of ILERA EKO to the very, very, very grassroots. And to discuss this, we have Mr. Seun Aderinoye. He is the Deputy EKOSHA Team Lead with the Lagos State Health Management Agency. You're very, very welcome.
Thank you very much.
Okay, so great to have you with us. And I was going to ask, because I was curious, what's the proper pronunciation? Is it? Did I get that? Was it EKOSHA?
Yes, it's EKOSHA.
EKOSHA.
Yeah.
Okay, great. So moving along, for the benefit of those listening to us for the very first time, can we do a bit of classroom work? What is EKOSHA?
So basically, the word EKOSHA, the EKO in front of it stands for Lagos. That is the EKO that we all know.
Yes.
So the SHA that's behind it stands for Social Health Alliance.
Oh,
so
Social Health Alliance.
Yes,
okay, great.
EKO Social Health Alliance.
Okay,
yes, that's the basic meaning of it.
Amazing. So tying it to ILERA EKO, what does this really mean?
Okay. EKOSHA is the resource mobilization arm of LASHMA.
Resource mobilization arm of LASHMA, okay.
That is the fundamental function of EKOSHA.
Okay.
So in line with the executive order, EKOSHA was specifically set aside to take care of the vulnerable coverage in Lagos State.
So this addresses the vulnerable in society.
Specifically, yes.
So who qualifies to be vulnerable? Looking at the state of things in the country, I'm sure many people.
Of course.
So who is vulnerable?
Okay, in terms of EKOSHA,
yes,
we classify vulnerable people as those people that cannot afford to pay for their health insurance.
Okay,
despite
from their own pocket.
From their own pocket, despite how cheap it is. So they can't afford it. We know it's a social health, it's an inclusive social health insurance. But despite that, some people still don't have the capacity to actually pay for these services. So that is why EKOSHA is here.
All right. 080-991-20777. That's the number you can call or send a WhatsApp message. 080-991-20777. Alternatively, you can also call 091-538-77127. Any of this will do. We'll definitely love to hear from you. If you have any questions, if you have any clarifications you might need, or perhaps you just want to commend the ILERA EKO team. Yes, the team right there at LASHMA, or share your experience. I definitely would love to hear from you. Meanwhile, from the Ikorodu axis, I have this update talking about vehicular movement all the way from the Olupomeji to Trailer Park towards Odogunyon, moving at a very good rate, while Odogunyon is moving freely. It's a better one connecting Gomat, NNPC Flower, and Second Gate. Approaching First Gate, it is slightly busy as a result of pedestrian activities, not forgetting the commercial buses. Further movement, fast moving inwards Okegbegun Sawmill, Last Mayard, all the way through to High School. It's also good towards I Foundation, Sabo Roundabout, Power Line, and Munirat Aleje. Journeying inwards Ikorodu Garage, Ikorodu Interchange, pardon that, it is a very good one. While moving towards Primero, it is appreciable, despite the fact that we have bus activities. Approaching Unity all the way through to Benton is encouraging. From Itamaga, navigating into Radio down to Musical Village, Grammar School, and Otaono is also a very good one this morning. Otaono en route Ladiga and Ojubode is a free one. Vehicular movement along Ayonbore Road from Ojogbe inwards Palace all the way through to the Ojubode end to Ikorodu interchange is a very good one. No impediment at this time. That's how things are looking like around that. And also we had an update around the Surulere axis of a broken down BRT bus having burnt tire problems at the descent of Eko Bridge in what's Alaka. A towing vehicle had already been reached out to, and it's not really affecting traffic at the moment. But you need to watch out if you're heading in that direction. And not to worry, we have traffic managers firmly placed around that end, just doing the needful, making sure things move as smoothly as possible on that stretch. We have Mr. Seun Aderinoye, Deputy EKOSHA Team Lead, LASHMA, doing justice to the topic of the LASHMA Rural Health Scheme, and he's been able to establish the fact that, you know, EKOSHA is an initiative of LASHMA, yes, that, you know, specifically for the vulnerable population right here in Lagos State, and he's also been able to define who vulnerable person is. Someone that's in this case, someone that's not able to pay for his health insurance, the policy, yes. Mr. Aderinoye, the Lagos State government through Lagos State Health Management Agency launched the rural scheme. I learned it happened last week.
Yes, last
if I'm
week,
correct.
yeah.
Yes. So could you just give us a bit of a background? Tell us why this was introduced.
Okay, so basically, in the course of the start of EKOSHA,
Yes.
yeah, we've had to get to a lot of areas
Okay.
whereby we've noticed a lot of difficult situations with people when it comes to accessing health,
Okay.
like quality health care.
Okay.
So most of these people, they don't have any hospitals near them. They don't have any PHC. They don't have any form of
in Lagos, yeah.
in Lagos.
Okay.
So most of these people live in parts that are very difficult to get to.
Okay.
So because of that, the agency was taxed.
So are you talking about like very hard to reach areas?
Yeah, areas that you would believe how you get there.
Okay.
Yeah, those places exist. We've identified some of those areas over the course of 4 to 5 years, and these places we've seen the need to help them out when it comes to access to quality healthcare. So that is why we've brought up about this particular rural health scheme, to help those people gain access to quality healthcare. But because most of them are solely reliant on midwives,
traditional birth attendants and all that.
So we want to shift from that phase to get people the proper health care they need, not just depending on the rural, which might sometimes be insufficient, which most of what they do is trial and error sometimes. So we get this foundation in place, and I believe we can get to areas over the course of time, areas that really need
those facilities and all that, and this kind of service. Okay, and also, aside providing the facilities, there should be also efforts at changing their mindset. Something that they're so used to, the traditional birth attendants and every other. So it should also be something that should be worked on. So let's look at what are the key goals that LASHMA is, the agency is set to achieve, especially for people in rural areas, in these areas.
Okay, the major goal of this rural health scheme,
yes,
from the crafting of it, because when we started it, the whole initiative, it was about having a state-of-the-art facility, like a mobile clinic, whereby we can take those buses, equipped buses. Those buses are to serve as a primary focus, a primary point of care for these people in these rural areas. So we take these buses into those communities 3 times in a week, like Mondays, Wednesdays, and Fridays. So people of this community, they come out to access the primary care they need.
Primary care. When you say primary care, so it's not nothing serious.
Yes, when we're talking about common illnesses like malaria and all diarrhea, hypertension. We have some complicated cases too that we found, even on the day of the flag off. Yes, we found some cases that we had to refer out of that rural area. But if this initiative wasn't put into place, such a person might not be able to gain access to the quality care that he needs. He will just be stuck in that particular area. Some of them die. So
before now, some of those cases, were you able to investigate and ask how they used to handle such?
Yes, most of them, they go to their traditional healers.
Okay.
So that is where they go to. But with the introduction of this initiative, that behavior would definitely change over time. So that is the idea of the rural health, to get these people the basic health care they need. So these mobile clinics, they serve as a main point of primary care. So once it is discovered that what they are actually there for cannot be handled by the mobile clinic. Arrangements have been placed with the local drivers, the keke napep operators, the bus drivers. So we pay them to make sure that these people get out of the community and referred to the nearest place.
Okay, so is there some sort of agreement or synergy with the local drivers?
Yes.
Okay.
We've made arrangements.
Okay.
With them. Even the Oba of that particular community is aware, the Bales are aware. So they are like our gatekeepers, the people we
so
really
to say,
talk
and
to.
they are familiar
with these people, so they know where they live, they know what they actually need.
Okay.
So that is the major goal of
in fact, you might not be able to achieve much if you do not parley with them actually.
Yes.
Okay.
Won't be able to.
All right. So looking at this, let's talk a bit about the benefits that people in these communities will have access to with this initiative. I know, yes, accessing care and all that, any other benefits?
Yeah. So basically, before, if people were going to the midwives to get their babies out, but now ILERA EKO takes care of that for the vulnerable ones.
Okay.
They go to the hospitals, the PHC, at no cost at all.
Okay.
They can access, if it is cesarean section, if there's need for cesarean section,
you take them.
We take it up from there. So those are one of the fundamental benefits of
so in instances where there are cases that cannot be handled right there, they can actually be
referred to a separate care facility.
Okay, where they will get better care and attention.
So those are one of the benefits. And also the common illnesses that I initially mentioned, the malaria, typhoid, diarrhea. When it comes to some chronic diseases or let's say like cancer treatment is also included. Then we have some how would I put it? We have some like inherited or genetic diseases like hypertension, diabetes. So those are some of the benefits that they draw. Full treatment for diabetes, hypertension treatment is also included.
All right, but of course, this vulnerable people, will there be some sort of database? Are you going to onboard them like you do for the regular onboarding? Like, will they have policy numbers, or is just everybody comes? How does that work?
Okay, so to make the system fair,
yes,
because anybody can just come up and say, I'm vulnerable. No, that's not how it works. So we have a system in place. We have an online assessment verification system, which we've developed in conjunction with the other agencies of the government as well, to make sure that this data is properly used.
Will that involve like questionnaires?
So at the registration point, there are questions that will be initiated to draw out the kind of condition, the living
information you need
about those people. So by that we can determine, okay, this person is vulnerable. This person can pay small. So there's that option. If we've assessed the person and we've seen that, okay, this person can pay a little bit and we come in and pay the rest. So there are options of subsidy for people who don't fully qualify as vulnerable, and there are some people who fully qualify. So for those who qualify as vulnerable, there's 100% subsidy for those. We take care of that with the equity fund. So those are some of the ways where the plan comes.
I was actually going to come to that how is all this being funded? So let's just talk about that.
Okay. First, the government is doing its part. On behalf of our governor, he has really done a lot. And recently, he just increased the allocation to 3 billion.
3 billion?
Yes, the equity fund. So from this equity fund, which is...
Please explain, what is the equity fund?
The equity fund is the consolidation of the 1% revenue of Lagos State that the government has assigned to take care of the health premiums of the vulnerable ones. So every year we get that allocation,
and that takes care of the vulnerable sector.
And then so far we've been able to onboard over half a million. Yes, we've been able to do that so far. So despite the effort of the government to make sure that the vulnerable ones are taken care of, we've found out that this is still lacking. There's still a lot of contributions we need. It's going to take a lot, because from statistics, Lagos State has the vulnerable population, the percentage of about 68%. So we are saying 68% of Lagosians are vulnerable.
So meaning there is still space for well-meaning individuals, corporate bodies to come in and be a part of this laudable initiative.
Yes.
Okay, so for those who want to be a part of this, how can they connect? How can they be a part of this? What's the process? How do they come on board?
So to come on board is quite seamless and straightforward.
Okay.
You can just reach out to us at our head office. Then all the processes can be outlined.
Okay.
Yes. So, and they can also reach us through our customer care contact to be directed straight to the channel where it's supposed to be.
Okay. Is it possible we just have those contacts? Is that possible? Okay, we'll come back to that and we'll have all the contacts and ways we can connect to be a part of this. But I have this question on WhatsApp. This person wants to know, okay, is Makoko part of the... Oh, you didn't tell me your name. Is Makoko part of the rural areas where you're going to? And... Okay, is Makoko part of the rural areas where you're going to? And if someone has to be referred to a hospital, okay, well, I don't understand. Okay, I think what the person is trying to say, okay, if someone, like we talked about where someone has maybe a health issue that you might need proper secondary care, what will happen? Will the person pay? I think that's what this person is. Will the person have to pay?
No.
Or will that still be handled by
yes, there's a system in place for that. So if there's need to be referred to a secondary facility,
yes, what happens?
We initiate this process from our head office.
Right.
So the person doesn't have to worry. All we need to know is, okay, do you want to be referred to, or if the hospital has recommended that this person be referred to secondary care. So we initiate the code from our end.
Okay.
By the time the person gets to the facility the secondary facility where he or she is going to, this appears on the system. Then they will know, okay, this person was referred to us. So it's seamless. You don't have to pay a dime to get referred to secondary facility. Once what you were taken to the facility for is covered under the scheme, so there's no need to make any payments.
Okay. Now we talked about the flag off, but we didn't give details. Now, where was this? I'm sure it was flagged off in one of the rural communities.
It was flagged off at the Agboyi Ketuoriomi community.
Okay.
It's
a riverine community.
Yes, a riverine community. That was where it was flagged off. And that day we had a huge turnout. The KBC was present. We had about 1,000 people present also from the community. So I can
only imagine the joy and relief.
Yeah, of course.
Especially from the mothers and the women in the community.
All of them came out. The KBC really tried.
Did you get feedback?
Yeah, we did. We currently we were aiming to get about 5,000 people in that community.
Okay.
And I know we can't capture them all at once, but gradually we've been able to accrue more than 3,000 of them.
Wow.
From the 3 communities at the Agboyi Unicom, because we have Agboyi 1, Agboyi 2, and Agboyi 3.
Yes.
So these 3 communities are coming out of their community to get registered. So where the mobile clinic was situated is like a central location that they can easily come from other communities to make use of it. So far we've got feedback from them. We've treated some cases that have been referred to the secondary care facility. We've had this success with that so far.
Wow.
But it's not going to stop there.
Of course,
we still have some communities that we are still going to go to.
Okay. Like instance, this person mentioned Makoko.
Yeah, the Makoko beat.
Yes.
We've been there several times. Yes, personally.
Because when you mention slums, I think
it's one of the slums. We have. But the initiative we've designed doesn't have a space for that kind of bus to get to where they are. So we are thinking of, in the coming future, we are thinking of another initiative that has to do with making use of boats. Yes. Boats. So that is still a plan we are still arching, though it hasn't come to fruition yet. But this is what we are planning for communities like that.
So innovation and all that to
doesn't
fit to the terrain and all that.
Yes, exactly.
That's something that would be quite heartwarming because, of course, people there need that. And so as you spread out, you expand, you reach out to more of these rural communities. Okay, so just before we round off, for those who want to be a part of this initiative and those who need more information, can we just get the numbers? that we can reach out to?
Okay.
Yes.
To reach out to us,
Yes.
you can reach out to us through 0700
Okay. 0700
453
453
72
72
356.
356.
Yes, some numbers might be 12 digits.
Okay.
So those are the toll-free lines.
Okay.
So you don't need to have credits before you actually call.
Once you call, someone will pick up. Could you just take it again?
Yeah. So 0700
0700
453
453
72
72
356.
356.
Yes. For the WhatsApp number, if you want to reach us via WhatsApp, you can reach us on 070
070
453
453
582
582
75,
75,
as well as 070
070
461
461
600
600
51.
51.
So those are our WhatsApp lines. Somebody's always at the end of that to respond anytime you have inquiries, anytime you want to sponsor. Maybe you have some particular group of vulnerable people in your community.
Okay, so you could actually just decide that you want to sponsor this
on your own. Yes.
All right.
Decide that on your own.
Okay, how about the vulnerables who perhaps do not stay in a rural area? You know, they might be somewhere in Bagada, for instance, but this set of people actually need this. How do we go about that?
So we also
are they still covered by this scheme?
No matter where they are.
Yes.
Because oftentimes we do community engagement.
Okay.
Community outreach.
Yes.
We partner with the local hospitals, the PHCs. We make sure those PHCs come out themselves in their neighborhood to make sure that this is what the initiative talks about. Let's mobilize people. We partner with them to make sure we get people, even though they are not in rural areas. We set those PHCs as like a point of verification for each community. And some private hospitals too are coming on board to make sure that we make them enrollment hubs where people can get access.
That'll be fine.
Yes, and then those informations are sent back to the office. Then we assign our field, because we have field officers across the 57 local government and LCDAs of Lagos State, to make sure that we have deep coverage in those areas. So if there are vulnerable people in such areas that are not rural areas, we have field officers in place to mop up all those kind of scenarios.
And they will also use the same channel to verify if they are actually vulnerable
or not.
Okay. That's quite a heartwarming one. So before I let you go, what message do you have for residents concerning the rural health scheme and ILERA EKO in general?
Okay. My advice to the community is don't disbelieve. Yes, I think the disbelief is the major crisis we are having. Does it work? Does it not work? That kind of scenario. So we've had a lot of issues around that. Don't disbelieve. When they say come out, experience it for yourself. That's the most important thing. That's the only way we can move forward in Lagos, because we don't intend to leave anyone behind. So if we are coming to your community, please welcome us and come out to register.
Welcome us and come out to register. It's been an amazing time on the show. I'm sure you learned a thing or two as we conclude today's episode of ILERA EKO Extra. Remember that health is wealth. Investing in your health is investing in your future. Don't wait until it's too late. Enroll on ILERA EKO today. Come on board, pick any one of the plans today and secure a healthier tomorrow for yourself and your loved ones. You can also go further to visit the LASHMA website. That's www.lashma.com, or visit any of our enrollment centers to learn more. You can also call on any of the hotlines we ruled out earlier. Of course, those hotlines, for the most part, are toll-free, so you can always, get more information. We would like to say a big thank you to Akan Usen, Assistant Director, Public Affairs of LASHMA. Also, a big shout-out to Halima right here in the studio, pulling the strings from the background. Thank you so much for bringing this episode to life. A big thank you to my guest, Mr. Aderinoye. Yes, for taking time.
I think you're the only one that actually get that right.
So big points for me. Yes. And thank you so much for taking time out of your busy schedule to come give us a bit of this gold nuggets, and now we can get to be a part of this. And to you, my dear listener, thank you for tuning in to ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM. Until next time, Akan Usen is my name, saying stay healthy, stay informed, and bye for now.